Yes, hello and welcome, my lovely audience, in another YouTube live session, YouTube live podcast. And all of you guys know that this October month is going on for breast cancer awareness and self care. And keeping that in mind, I have invited oncologist Sarah Arif today. She has joined us the stage with us, and with that, Mahwish Akhtar, she has joined the stage. Hello and welcome to Sarah and Mahwish, and along with that. Uh, Fatima Umar, she has also joined us. I'm so sorry because you people are new for me today, so that's why
Thank
need
you.
to see the I need to see the names. And also my lovely friend, she has also joined the stage, but she has left for a few seconds, I can say, but she will join back soon. Anila Khan, so she is a psychologist as well. So she has joined the stage as well, meaning like she will join the stage. I'm so sorry. Before that, I was struggling with some sort of internet issues. That's why I am just also adjusting myself. So sorry for that. That's why I got late. But it happens that, when we go live, so a lot more things we have to, deal with and we struggle with. But finally, I am here with my lovely experts, and we are going to discuss about self care and breast care awareness. I would begin first because Fatima Umar, she has joined us for the very first time, and with a light conversation in the sense when we talk about self care, what do we mean by self care, especially when we talk about women? So Fatima Umar is a yoga and mental health expert, and we know that how much mental health importance is there, especially for when we talk about women. So I would begin from Fatima. Please unmute yourself and about self care when we especially highlight the women mental health sort of issues or mental health importance. How do you see? Please go ahead. Mike is yours.
Assalamualaikum everyone. I hope I am completely audible to all of you. Yeah, I guess
Alaikum
so.
salam. Yes.
Yeah, that's good. Okay. So when it come we are talking about the wellness, or when we are talking about women's health, or we are talking about self-care or self-love, we are talking about the holistic wellness. We are not talking only talking about like physical health, or we are not talking only about the mental health. We are not only talking about the emotional health, but when it comes to the health, it comes with the holistic wellness. It includes your personal hygiene, your nutrition, your your physical health, your mental health, your emotional health, everything. Because when it comes to, let's suppose if we are talking about women's physical health, there are many women when it comes to the Pakistan, or when it comes to the Africa, or when we are talking about globally, they are, most of them are malnutritions. So they are not taking their diet properly. I'm not talking about 100% of the cases, definitely rare exceptions are always there, but when it comes to the diet, we have to take care of us more. And when it comes to the physical exercises or the physical routine, so some people are doing it very nicely. They are having their gym routine, yoga routines. They are doing their exercises, walks, running, and jogging very properly. But again, there are many more females who are not taking their particular things properly. And when it comes to the mental health, more than women, more than men's, women's are suffering and the mental health issues more, because according to the researchers, there are almost 60,000 thoughts in our mind on a daily basis, like, right? So most of the thoughts are related with the past. And when it comes to the females, according to the science, according to the researchers, when it comes to the females, they are attaching with the things more. So they are responding towards the emotions more. That's why their mental health suffers comparatively more than men. So when it comes to the women, the holistic wellness is very important to take care of them, whether it's physical, their diet, their movements, or their mental health. So this is what I feel. We have to take care of our complete health, not only talking about just one aspect.
Thank you so much, and thank you so much for a sort of a beginning statement. And I fully agree with you that, like, when we talk about the ladies or women's physical health, is equally important about emotional health as well, mental health as well. We would just keep on continuing with that as well. But as today's show is very special, because keeping in mind that this Pinktober is going on, and where we try to bring up more awareness in regards for breast cancer, I want to give one story here before going to my guest expert, oncologist Sarah. It's something I just came across with one video of a one influencer's wife, and she also from her side wanted to give some awareness, and she shared her story. In her story, when she said it, that she was having a sort of painless kind of lumps, or you can say sort of like thick tissues, hard tissues on her body some way. um, and she said it, that she went to the, like, to the doctor, and they said it, okay, it's just like, lumps, and either, like, I'm going to give you the medicine, and they will be removed itself, or if you want it, maybe later on you can remove it through surgery or other procedures. And then she came back home. It was just a beginning, like, of her, maybe can say stage one cancer, breast cancer especially. And she came back and she started to take medicine and stuff, and but she was not recovering. Internally, she was having some sort of, like, sort of stomach issues, sometimes diarrhea, sometimes constipation, sometimes not feeling well. Maybe you can say her breath was like sometimes abnormal, meaning like she was not feeling good, she couldn't walk properly. So some sort of petty issues were also going along with her main issue. When she went back, again, something like, was the same story. But then she took the name of one particular specific doctor. I forgotten the name for that. And she guided her that, yeah, this is a sort of major issue, which is a breast cancer. Normally people do not really consider, especially when it comes to women. They also do not take care of their physical health, and somehow they ignore their physical health, in the sense that, okay, I'm like, they just keep on delaying, okay, we will go the other time, or the, like, we are having this issue or the other issue. Or maybe doctors, they do not guide them sort of, proper way, that, yeah, this is the issue, and they initially just they take it so lightly. So after that, like, when she reached, maybe, Sarah is just, got off from the camera, maybe she'll be back, so I'm also waiting for her until I would continue her story. After that, what happened, that when she went back to that doctor, and that came out that, yeah, she has got to a final stage of her breast cancer, meaning the time being delayed a lot. And some way somehow, uh, my mic, am I audible? Is it fine? Okay, right. And she's back as well. Okay, so yeah, she reached up to a final stage of cancer. And my point of bringing up that story, because what she was doing to share her personal story with her audience or with her followers, for the sake of awareness, and what she is suffering, and she didn't want other people or other ladies to suffer with this critical sort of condition. That's why she shared her story. So my point, and I would welcome Dr. Sarah, for opening up about this issue, that isn't it that early diagnosis is good? How do you see it? And then after all, as we will also bring up the Pakistani statistics and data about breast cancer, in women, in ladies. So, how do you see it? Please, mic is yours. Unmute yourself. Welcome to the stage, and hope you're doing well. Please, about this question, this particular issue, what would you say?
Greetings to everyone. Thank you so much, Kiran. I hope I'm audible to everyone. All right.
Yes.
So, before I begin, I would just mention one thing that I am an oncologist, but I'm a surgical oncologist. I'm a surgeon basically. I'm a general interest surgeon. So, medical oncologist is the one who treats with medicine. I'm a surgical oncologist. Coming back to your question, that early diagnosis, yes, early diagnosis is indeed essential. Why? Because when we talk about breast cancer, it is the most common cancer among females worldwide. And not only it's the most common cancer, but it is also the most common cause of cancer-related deaths among women worldwide. So, why do we focus so much on early detection? Is that in early stages, breast cancer survival rate is more than 90%,
Mhm.
right? So the deaths that we have all over the world out of because of breast cancer, two-thirds of those deaths are reported in the underdeveloped countries like the Asian countries or the African countries where health facilities are not much, or where people are not generally aware or they find it a taboo to speak about breast as a part of the body. Whereas in the Western world, the death rates are almost one-third of the total numbers that we have. Why? Because in the West, the screening programs are so strong, the surveillance is so good that number one, people are well aware of the disease and how do they need to take care of it. And number two, because of these screening programs, the disease gets picked up at a very early stage
Correct.
when the disease has not even come into its form. It just shows up at a small patch as a small dot on the mammogram or the ultrasound. And that's how people are picked up early. And early stage survival, just like I mentioned, it's more than 90%. That is why the entire focus of the breast cancer campaign is on the fact that it is a potentially curable disease. Breast cancer does not mean a death warrant. We need to spread the awareness and save lives.
Thank you so much. I was just coming back to you again for more questions. Just readjusting the sort of like topic and the initial things which I also wanted to just open up with from somewhere. But thank you so much for responding to that. And then I'm coming back to you again for other stuff as well. Malvish Akhtar, she has joined us as well. And suppose if a lady is suffering with this critical condition, it would also be affecting her mental health as well. Because the way she used to spend her life before, it will not be the same after this critical issue. What sort of advice would you like to give? Or, of course, if you can share a little bit condition in the sense that she might be suffering with some sort of mental health issues. How do you see it and how to cope up if it's not a cancer, it may be any other issue, then like a patient or a lady, she should tackle with it, she should cope with it, like with the keeping her mental health also in balance. How do you see it? What advices would you like to give to my audience? Please, Mike is yours. Go ahead.
Thank you so much, Kiran. Kiran, first of all, before going for any treatment, right,
Mhm.
any issue, any either it's a mental health issue, either it's a physical health issue, first we have to accept it as a issue, as a problem, right?
Mhm.
Even if person do not accept it, they cannot move forward for it, right? अगर हमें इसके बारे में आइडिया ही नहीं है, अगर हम उसे एक जनरल तौर पे कंसिडर कर रहे हैं कि ये तो होता ही है, ऐसा तो होना ही है, तो हम उसकी ट्रीटमेंट की तरफ नहीं जाते और एज अ वेमेन हम इस चीज़ को बहुत ज़्यादा इग्नोर करते हैं। ठीक है, हम जिस सोसाइटी में रह रहे हैं उस सोसाइटल प्रेशर की वजह से हम बहुत सी चीज़ों को एज अ जनरल परसीव कर रहे होते हैं। ठीक है, एज अ सोसाइटी हमारे अंदर ये एक्सेप्टेंस नहीं होती कि हम इसे एक प्रॉब्लम के तौर पे कंसिडर करें। सो फर्स्ट ऑफ ऑल वी हैव टू कंसिडर इट एज अ प्रॉब्लम एंड वी शुड नो अबाउट इट कि हमारे साथ हो क्या रहा है। जब हम उसे कंसिडर करेंगे तो हम उसको ओवरकम करने की कोशिश करते हैं।
Mhm.
And this is a human behavior. We cannot take any good decision in a stressful condition. राइट? अगर हमें वो प्रॉब्लम पता चल गई है, वी कम टू नो अबाउट इट, हम स्ट्रेस फील करने लग जाते हैं, राइट? वी थिंक अबाउट फ्यूचर कि अब क्या होगा, right? First of all, we have to control over it. And for
Mm-hmm.
this, we have to control over overthinking phase, right? We have to
Mm-hmm.
focus more on solution rather than what will happen in the future, right? सो एट दैट पॉइंट ऑफ टाइम जब हम प्रेजेंट में सोचने लग जाते हैं, हमारा माइंड रिलैक्स होने लग जाता है, डोपामाइन रिलीज होता है, हमारे स्ट्रेस हार्मोन्स कम हो जाते हैं, हैप्पी हार्मोन्स, रिलैक्स हार्मोन्स जनरेट होने लगते हैं, और हमारा माइंड अल्टीमेटली रिलैक्स पोजीशन पे जाता है। एंड एट दिस स्टेज वी विल बी एबल टू टेक मोर गुड डिसीजंस इन लाइफ, राइट? जब माइंड रिलैक्स होगा तो आप डिसीजंस ले सकते हैं कि अब हमें क्या करना है। तो सबसे
Mm-hmm.
पहले तो हमें अपने स्ट्रेस को कम करना है, राइट? अपने माइंड को रिलैक्स स्टेट में लेकर जाना है, ताकि हम वो फेयर थिंकिंग से बाहर आ सकें, ठीक है? अपने आप को हम पहले, सबसे पहले अवेयर करवाना है, नेक्स्ट स्टेप पे हमें अपने आप को फेयर थिंकिंग से बाहर लेकर आना है, स्ट्रेस जोन से बाहर लेकर आना है, राइट? जब हम ये 3 चीज़ें कवर कर लेंगे, आफ्टर दैट वी विल एबल टू फाइंड आउट द बेटर सॉल्यूशन फॉर आवरसेल्फ, राइट? तो इसके बाद फिर आप देख सकते हैं कि हम हमारे लिए बेस्ट सॉल्यूशंस क्या हैं। अगर हम कोई भी ऐसी प्रॉब्लम्स को फेस कर रहे हैं जिसकी वजह से हमारी मेंटल हेल्थ इश्यूज इफ़ेक्ट हो रही हैं, मेंटल हेल्थ हमारी इफ़ेक्ट हो रही है, तो अच्छा, सबसे ज़्यादा ये हमारे साथ होता क्यों है? क्योंकि हम अपनी सेल्फ को, हमें हमेशा, हमने ये लर्निंग्स की हैं, हमें दूसरों का ख्याल रखना है, राइट? टेक केयर ऑफ अदर्स, वी नेवर लर्न अबाउट हाउ कैन वी टेक केयर ऑफ आवरसेल्फ, राइट?
Mm-hmm.
तो जिस स्टेज पे हमें अपने आप को हम प्रायोरिटी पे रखना शुरू कर देंगे विदाउट निग्लेक्टिंग अदर्स, लेकिन अपने आप को भी हम प्रायोरिटाइज करना शुरू कर देंगे, उस स्टेज पे हमारे हमें अपनी वैल्यू फील होने लगेगी, और जिसको अपनी वैल्यू फील होने लग जाए, डेफिनेटली वो अपने आप पे वर्किंग स्टार्ट कर देगा,
Mm-hmm.
राइट? सो दिस इज ऑल, कि सबसे पहले हमें अपने आप को प्रायोरिटाइज करने की ज़रूरत है,
Okay.
हु वी आर हम। यस।
Okay. Thank you so much. I'm coming back to you again. Uh, Anila will join us. Okay, Anila is here. Okay, but before going to Dr. Sarah, I want to pose one question from Anila as well. Hope you're doing well, Anila. And I was
Am I
just
audible?
not accepting, like, yeah, that. But yeah, you're here. Thank you so much. Okay, so the question here, when we talk about self-care, and a lot more people, they like, I also, when it comes to self-care, I also see it like self-love. And when I say self-love, people, they take it a sort of a negative connotation, in a sense that, oh, self-love means you. Is it the case that when we talk about self love or self care, we be selfish? They're not supposed to be a me time, but they're supposed to be a time for everybody. Like, we taking a lot more stresses for other people, but when we would think about ourselves, then we would become selfish. And this is a sort of people's mentality, maybe especially in Pakistan, that okay, you always have to, as a woman, you always have to give, but you can't take anything. What would be your take?
Okay, thank you so much everybody for coming here, and thank you so much Kiran again, and thank you for waiting, all of you, for me. I was into some domestic thing actually, and there was this cat and there's this construction happening around and things are crazy. But beyond that, the topic that you're talking about, and what I feel is, when we start talking about self care, and we were having this discussion yesterday as well, because we were having some event over here, and people would say, I take care of myself, I am focusing on myself, and I have seen all of them who are sitting over there, and I have seen them wearing branded clothes, wearing expensive lipsticks, and other stuff. So what I felt is, for them self care is more like how you're carrying yourself, and you getting ready and going out and stuff like that. And I have seen them uh, being judgmental to other people. Like, you are in a place where we are talking about self-care, and we are talking about breast cancer awareness, and we're talking about how you can take care of yourself, how you're supposed to carry your body, and still you're doing the same. And there was one other woman, and She was, I don't know, she was a therapist or not. I didn't get a chance to talk to her, but she was saying that because nowadays we have many people who claim that they have done some kind of diplomas and they become therapists all of a sudden, or they were free and they did that. So she was also very judgmental to women who were talking about their body, that after my second child, I'm not able to feel the way that I used to feel before, and whenever I go and take a ride, uh, I feel dizzy. And she was saying ये सिर्फ आपके दिमाग में है, ऐसा कुछ भी नहीं है. So when we thought about understanding the real concept of self-care, it's not just about thinking good about myself. Okay, I start feeling good about myself, and we don't understand that we are the people who are saying that they are touching the phase of delusion, like they're being delusional about themselves, or they're trying to act like toxic positivity. Like for example, if I have a problem right now and I start telling you, no, there was not a problem and stuff like that, so it means that I am avoiding the problem. I'm not understanding, or I'm avoiding the real question that yes, I have a problem, and I have to make sure that I just take over that problem, because sometimes when you're online, discussion go sometimes go long and we don't get a chance to talk about that. So the real help will be if I don't look for myself, oh, I don't have tea right now and I will take it later on, and meanwhile talking to you people I start feeling headache in my headache. The self care would be understanding that I am a human being. I have limitations. I cannot be everywhere all the time. Maybe even if my job is like that, I cannot be like that. And I have to understand that when I have to take break from everything, I am not supposed to give my opinion all the time about everything. Sometimes I will not like things, and sometimes I will not be comfortable with the discussion that is happening around, but maybe I stay quiet, maybe I leave that place, maybe I give my opinion as well because I'm listening to them by creating a positive space around me. So this is how self is coming from internal side. From external side, it is boundary setting. And boundary setting would be, for example, if I I'm not able to do something, I'm not able to go to some place, I'm not able to wash clothes, let's say, or wash my dishes because certain reason, I tell my parents that I cannot do this, or I'm not feeling well, I will do this later on, stuff like that. So these things start coming in boundary setting. Then if you talk about friends, that if you feel that they're all the time judgmental toward you, I think that's the time that you start taking some kind of distancing from those people. So self-care is not just you taking care of your body, it's about placing yourself in a place where you're comfortable, or creating that area around you. And people would say that what about those people which we cannot avoid, so then that's the time that you have to have that discussion around them. If you're not comfortable in some topic, don't talk about that. So that's how you can carry on the concept of self care in actual terms, rather than and I always talk about one thing, that children have to understand that, or parents have to understand that they have to have a boundary around their children, and they have to start that boundary from start. And self care would be understand that you're a human being, you are limitation, you cannot be everywhere all the time, and eating good things, and talking good about yourself, and letting other people understand that yes, you matter. But again, thinking about, oh, if I will be everywhere, I need to be everywhere all the time, and I need to be very kind to people all the time. Saying no is not the sign of kindness. I'm sorry, unkindness. Saying no to is not the sign of that you're being badtameez at that time. And I have seen sometimes people are taking advantage of adult being adult, or child being a child. So then that it's the job of adult that to understand that they have to create a positive thing, or maybe they have to create a positive self image, which is difficult to attain in this society, in terms of positive self image means that everybody like me. But the real positive image is what in front of me. Am I looking toward myself from their eyes, or I am looking toward myself, what I feel about myself? So I think we will carry
Thank you.
on this discussion, but I try to, give a very layman examples, to understand what is actually self-care.
Definitely, I would agree with you. And of course, sometimes when we say no, so that doesn't mean that, like, we being mean, and or sort of like, showing the negative gesture. It is something like sometimes it happens for our good as well, because a sort of image as we want other to see for ourselves is always like we have to keep an importance, like in the sense that what image are we creating for ourselves? Is it something like, lethargic, lazy, dull? Or we also have to see that image for ourselves as well in the mirror, or as a reflection that, yeah, we are also healthy, we are also good, we are also active. And of course, if we are active, so then we can help others. Thank you so much for that. Dr. Sarah, I want to pose a few questions here. And if we look at the Pakistani data, it's almost about like, 1 in 9 women, they are at risk of developing breast cancer. Around 40,000 women, they die each other. And a sort of a concept that breast cancer is only women they have. But I think, and you can also confirm that, gents can also have the breast cancer. And when it comes to the most common types, you can also discuss some types of cancers, breast cancers as well, not especially breast cancers as well, and which type of breast cancer is more sort of like, alarming or dangerous, you can say for that. And the last thing which I can think of, is it hereditary as well? Meaning, yeah, not all the cancers would be hereditary, but some I've heard that they are hereditary. So, what would be your take on it? Please, Mike is yours.
So these are quite a few questions. I'll go about them one by one.
Mm-hmm.
Firstly, you asked me that yes, Pakistani women, the incidence of breast cancer in Pakistan, our women rank somewhere third in the world when it comes to the rate and the incidence of breast cancer. So that's
Shame.
a pretty alarming situation. We unfortunately don't have a national cancer registry in Pakistan, the sort of registry which documents the number of cases, annual cases, new developing cases, and the type of cancers that are occurring. But on a rough estimate, there are around 90,000 to 95,000 new cases of breast cancer in Pakistan each year.
Yeah.
And like we just mentioned that around the death rate is around 50%, 45,000 die each
Yeah.
year. And I still think that this is an underestimate of the entire situation because there are many women who do not see a doctor.
Register. Mm-hmm.
Yes, they don't register. They don't have a healthcare facility, especially in the far-fetched areas. Or even if they have the facility, this is still considered a taboo to, talk about breast health and
Yeah.
or they would say, oh, it's got breast cancer ho gaya hai," something like that. So people don't go, and we don't have the exact figures. But still, it's an alarming situation in Pakistan. Also, that in our women, breast cancer is occurring at every age. It's no more that you can say it's a disease of the elderly females only. It's occurring. The youngest patient that I've seen was 19-year-old.
Mm.
So it's
Mm-hmm.
very common in the 20s and the 30s. And
Yeah.
as the age increases, obviously the risk increases. And that's why they say that in Pakistan, 1 in 9 women is at a higher than average risk of
Mm-hmm.
developing breast cancer at any stage in her life.
Mm-hmm.
There are certain risk factors, and then there is an average risk population that most of us are. We all are because of our, our ethnicity and the genetics that we have. We are all at an average risk, but certain risk factors, if present in any woman, can put her at a higher than average risk. Then you spoke about men. So when we say 1 in 9 men, we say 1 in 830, 850 men. So that makes up
Oh,
around 1% of the total number of breast cancer cases all over
they
the
are
world.
safe. Yeah.
Yes, they are safe. Not that they cannot have, they can have, but it is very rare.
Very rare.
One in
Yeah.
850 men. Especially the men who get affected by breast cancer, they're the ones who having certain genetic mutation in the family. Like you must have heard of the BRCA1 and the BRCA2 genetic mutation, which is present in some family, makes a lifetime risk of developing breast cancer around 80%. So men are also affected in that case. Or if
Mm-hmm.
there's a strong family history, like over successive generations, then that family needs to get the genetic testing done, including which include the male and the female members both. So yes, this is one thing. Then, like I was just listening to the experts, and they rightfully mentioned that people do not take care of themselves. Self care means maybe dressing up properly, and and the life is too fast paced. They don't have time for themselves. We have a sedentary lifestyle, right? We just go do a table desk job. We come back. We do not have any sort of physical activity or exercise in our lifestyle, in our routine. We don't eat healthy.
Yeah,
Then smoking and drinking is, to an extent, it is also a part of the Pakistani society. So these all
definitely.
are risk factors of breast
Mhm,
cancer. Stress
mhm.
can, like it causes other diseases, it generates certain toxins that can, disbalance the normal cycle in the body, along with the smoking and obesity, a sedentary lifestyle, and we label them as the modifiable risk factors of breast cancer. I mean, if we
Mhm.
can control this and live a healthy lifestyle, we can reduce, if not totally eliminate, but we can reduce our risk of developing breast cancer. So yeah, self-care
Okay.
actually means taking care of yourself, just not
Mhm.
taking care of the how the way you look or how the way you dress, but essentially taking care of yourself.
Okay. Thank you so much. I will come back to you again for the common type of breast cancer, the mammogram when it's supposed to be done, and sort of about heredity thingy. Like, is it also heredity that you know? But before that, I want to go to I'm so sorry, Fatima. Yes, Fatima. So I want to know something about your work as well, because very interesting. When I was just checking your profile, your bio, it was something also added up that you are running a sort of institute where you help, especially ladies, with their along with mental health issues about their physical look or physical sort of shape as well. Like you give them the yoga classes. First question
Yeah.
which I want to ask is something that when people they come, do you also ask them about their life routine or lifestyle, or do they use any drugs or something like alcohol or especially cigarettes or something, any kind of substance? So do you ask them first, because that would also help? Like, suppose one side you're doing yoga, but on the other hand your lifestyle is not good, so will it help? So, yeah, question to you, please. And if you can say something about it, please go ahead. Mike is yours.
Yeah, thank you so very much once again, Kiran. Okay, so let me share a few lines about my story, why I have started my that particular wellness journey, holistic wellness journey, and why this Be Fit with founded.
Mhm.
कैसे बनाया क्यों बनाया so I was doing my life in a quite good way and I am diabetic type 1. So once my body went to decay, that is diabetes ketoacidosis, and I went to the ventilator and then coma. Doctor told my parents आप लोग दुआ करें, and like she coma में जा रही हैं, and then it was like an ICU and then on wheelchair. So at that particular time I realized that okay, this is me, but this is not me. I ended up on wheelchair. I need an assistant even for going to the washroom at that particular time. And that time made me realize I have to work on myself, not only physically but mentally too. Let's suppose we are talking about this particular breast cancer awareness month. When it comes to the early diagnosis, females feel really shy when
Yeah.
doctors ask them to just, to look at yourself and just see that कि अगर कोई आपके lump तो नहीं आ रहा, कहीं पे कोई swelling तो नहीं है, कोई patches तो appear नहीं हो रहे. So when it comes to us females, when I'm talking about this particular society, we people are really shy to discuss all these things. इसी वजह से ये सारी चीजें हमारी आज की society में बढ़ रही हैं. When it comes to yoga, when it comes to the physical wellness, along with the mental well-being, they both work together. ऐसा नहीं है कि आप फिजिकली बहुत फिट हो जाएंगे और आप मेंटली आप बिल्कुल ही अजीब से होते रहेंगे. बिकॉज when it comes to the physical workout, exercise releases the dopamine, the happy hormones in our body. एक्सरसाइज
Mhm.
करने से आपका जो होता है वो cortisol लेवल कम होने लगता है. Let's suppose if you're talking about me, I'm specialized in mindfulness and well-being, मेडिटेशन. जब हम मेडिटेशन करते हैं तो हमारा पैरासिम्पैथेटिक नर्वस सिस्टम एक्टिवेट हो जाता है, तो आपका कॉर्टिसोल लेवल खुद ही काम होने लगता है, नीचे आने लगता है. सो और आपके हैप्पी हार्मोन्स रिलीज होने लगते हैं. सो व्हेन इट कम्स टू आवर क्लासेस, I'm helping not only females there. Let me correct here. We are working with the corporate sectors. We are working with the hospitals, the big hospitals in Karachi, and we are working with the old age homes for their mental exercises, for their physical halki fulki movements, chair yoga, and all that. Basically, I'm US International Certified and Registered Yoga and Mental Health Therapist, Alhamdulillah. So I'm working with a, on a broad spectrum,
Yeah.
not only females, not only males, not only kids. So we are working on a broad spectrum because when it comes to physical health or mental health, this is for all of us. इसमें
Right.
कोई हम जेंडर बायस नहीं हो सकते, इसमें हम कोई एज को सेलेक्ट नहीं कर सकते. Okay, now let me come back to your question. Say that was what questions we are asking before they are joining us. Okay,
Mhm.
so we are the pioneer of online one-to-one sessions in Pakistan before COVID.
Mhm.
Right after COVID, everything was online. We all knew that, but we are the
Right.
pioneer of online one-to-one sessions in Pakistan before COVID. At that particular time, we have some questions.
Mhm.
So we need to ask them, what's your age, your name, what's the purpose of your joining. एंड
Mhm.
देन दिस इज नॉट द थिंग कि आप मेरे पास आ रहे हो और आप एक्सरसाइज कर रहे हो एंड दिस इज टाटा बाय बाय, हमारी क्लास 2 दिन बाद होगी या 1 दिन बाद होगी. सो एट नाइट द पीपल नीड टू सेंड मी देयर रूटीन व्हाट दे हैव टेकन, and we will just calculate the calories and we share them back again. Sometimes let's suppose आपको किसी बर्थडे में जाना है या आपने कुछ एक्स्ट्रा खा लिया, you just let us know कि वी
Mhm.
हैव दिस, तो हमें पता चल जाएगा कि आपने भाई इतनी कैलोरीज ज्यादा खाई हैं, आपको 1200 या 1500 कैलोरीज खानी थी, आपने 1800 कैलोरीज खा ली है. सो नाउ व्हाट वी विल डू इन द नेक्स्ट क्लास, वी विल मॉडिफाई आवर वर्कआउट अकॉर्डिंग टू योर बॉडी, और फिर हम उस नेक्स्ट क्लास में मजीद कैलोरीज बर्न करेंगे. एंड अगेन द थिंग इज दैट कि आपका लाइफ स्टाइल, जो मेरी टैग लाइन है दैट इज लव योर सेल्फ. तो आप अपना लाइफ स्टाइल खुद ही चेंज करने लगते हैं जब आप अपने आप से प्यार करने लगते हैं. एंड अगेन सेल्फ लव इज नॉट द सेल्फिशनेस. सेल्फ लव इज जस्ट टू केयर अबाउट योर सेल्फ, जस्ट टू discipline yourself, just to listen to your body. Self love actually make us more humble, not to only others but for ourselves as well. So this is how we are working in that particular. And by the end of every session we are conducting, we continue with the meditation. And
Mhm.
let me show you one thing of mine as well. Just give me a second.
Sure.
Okay, so along we ended with the meditation, and being a girl, I would love to continue with special yoga always because every one of us wants to look younger and definitely useful. But along with that, this is my gratitude journal, and
Mhm.
I'm maintaining these journals gratitude for last past 9 2025, yeah, almost 9 plus years, 10 years. So this is my
Mhm.
gratitude journal, and I always
Beautiful.
like to be grateful
Wow.
for Alapak. Like
Mashallah.
just be thankful for your breath, for your eyes, your visions. Like let's suppose I have told you that I am taking insulin because I am insulin dependent. I have to take insulin before every food. But
Mhm.
shukar alhamdulillah, I'm not taking any other drug. I'm not depending on anyone else. I'm running my own business. I have my family. I have my parents. I have everything in my life. So I'm very thankful that this particular condition I'm living with, it's okay. And I really like to second the Mehwish, the way she said in the first line. She said we have to accept the thing first. बिकॉज
Hmm.
जब तक लेट्स सपोज अगर किसी को कैंसर भी हो गया है, तो जब तक वो एक्सेप्ट नहीं करेंगे कि उनको हो गया है, वो इलाज नहीं कराएंगे. और अगर इलाज भी करा लेंगे तो उनको वो चीज उतने अच्छे से असर नहीं करेगी बिकॉज एवरीथिंग इज कनेक्टेड हेयर.
Hmm. Right.
Whatever we are doing is connected here. So
Yes.
first thing is acceptance, and then
Mhm.
second first thing is acceptance, diagnosis, and then how many measure, like cures, how many precautions we can take along with the diet and exercise and any other thing. What we can do with that
Mhm.
पर्टिकुलर स्टेज, वो डॉक्टर्स ही बता सकते हैं कि आपको किस स्टेज पे किस तरह से अपने आप को ठीक करना होता है. बट आई ऑलवेज रिक्वेस्ट ऑल द फीमेल्स कि अगर आपको एक चीज बताई जा रही है ना, डॉक्टर्स आपसे कह रहे हैं जस्ट टू चेक योरसेल्फ, please do check yourself. Please do
Mhm.
that. Let's suppose I am diabetic. Again and again, I'm talking about diabetes because definitely I'm living with that condition. So I'm
Right.
living with the diabetes condition. So I have to really take good care of my feet. हमें पैरों का बहुत ख्याल रखना होता है. कुछ चुभे नहीं, नेल्स कट हो, प्रॉपर ट्रिम हो, ये हो वो. सो आई एम
Mhm.
रियली doing that with myself. But you never believe that. We have seen those people as well जिनको diabetes है और वो लाइक परवाह ही नहीं कर रहे, कोई से भी शूज पहन ले रहे हैं, किसी भी जगह पे ग्रास पे चलने चले जा रहे हैं, बीच पे नंगे पैर वॉक कर रहे हैं, हमें नहीं करना है. So all these things particularly we have to take care our body, our mind, our different things according to our condition.
Mhm.
So this is something I would like to, with your platform, I would like to just say this message to all of you. Just do care yourself.
Thank you
ताकि
so
एटलीस्ट
much.
आपकी डायग्नोसिस तो हो सके. थैंक यू, थैंक यू,
Of
थैंक
course. Thank you so much. Yeah. I maybe come back to you, of course, but we will see the time as well. Yes, Mahvesh, mindset coach. When we say mindset coach, of course, that you are setting the mind who are like, disturbed in any way, or especially when, there would be your female clients or female, I can't say patients, but female clients. So, mind setting, when we say self love, self care, how much mindfulness is important in self care and self love, and controlling people emotions, like there would be a lot more emotional disbalance happening in this situation, in this condition, when even though they would ask for help, seek for help, seek for an expert, but they don't know that, okay, loving ourselves is just to say it's not really okay. We have to understand also that how could we love ourselves, and what are the things which are important as an elements for taking care of ourselves or loving ourselves, to include those things as an ingredients, that yeah, if those ingredients are done, then your recipe is full, or your recipe is complete. How do you see it, and what would you like to share about mindfulness connection with the self-care or self-love? Please, mike is yours, go ahead.
Thank you so much, Kiran. This is one of my favorite topic that you have asked. Right? Uh, होता क्या है हमारे साथ as a women? We are extremely depend on the emotions because of the other sections. हमारे इमोशंस हम इमोशनली बहुत ज़्यादा डिपेंड कर रहे होते हैं दूसरों के एक्शंस पे. One of my coaching clients said that yesterday some guest come in my home and my one of my family member do not behave well, and I feel very embarrassed in this situation. I said, okay, for suppose some guests come in your house and you do not serve them, right? You do not attend them properly, who will feel embarrassed? She said, I will feel. I said, okay. So if somebody come your home और किसी ने अच्छा behave नहीं किया, तब किसने embarrassment feel की? She said, I feel embarrassed. I said, why? In both conditions, why are you feeling embarrassed? You are responsible for your actions and other person is responsible for his or her actions, right? But हम दूसरों के actions की वजह से अपने emotions disturb कर रहे हैं, राइट? और दोनों कंडीशंस में जो नेक्स्ट पर्सन है वो एम्बेरस फील नहीं कर रहा. एंड शी सेड, yes Navish, I am wrong, means I have to take care my emotions, right? So when children similarly, अगर कोई मदर है उनके बच्चा मिसबिहेव कर रहा है, शी स्टार्ट शाउटिंग या डांटना स्टार्ट कर देती हैं. बच्चे का एक्शन सही नहीं है, अपने इमोशंस डिस्टर्ब कर लिए. हस्बैंड ने सही बात नहीं की, उनका मूड ऑफ है, अपना मूड ऑफ कर लिया. लाइक फॉर अदर सेक्शन, फॉर बॉस ने मीटिंग कॉल कर ली, बॉस ने इंसल्ट कर दी, अपने इमोशंस डिस्टर्ब हो गए. व्हाई? दिस इज नॉट इन योर कंट्रोल कि आप किसी के एक्शंस को सही कर सकें, बट यू कैन टेक केयर ऑफ योर इमोशंस, right? So but as a human and especially as a woman, we always depends on other sections, right? And we never think about our own emotions कि अगर हमारे emotions disturb हो रहे हैं तो हम mentally कितना ज़्यादा disturb हो गए. अब वो एक situation को लेके she fight with her husband as well. बच्चों के साथ टाइम अच्छा स्पेंड नहीं हुआ, पूरी रात डिस्टर्ब गुजरी, नींद पूरी नहीं हुई, जस्ट फॉर अ सिंगल एक्शन, राइट? और वो एम्बेरसमेंट और गिल्ट की फीलिंग से अपनी लाइफ डिस्टर्ब कर ली. सो फर्स्ट ऑफ ऑल I start with taking the responsibility of your own actions, right?
Mhm.
You can only responsible for your actions. You are not responsible for others' actions. This is the key point. If you want to live happy, if you want to feel relaxed in your life, right? And similarly, and all these things, because we live in a society, we have different connections with different peoples, we all are human beings, right? सो हमारे हम सबके साथ दो बेस्ट लोग भी आपस में उनके नज़रियात चेंज हो सकते हैं, उनकी वैल्यूज़ चेंज हो सकती हैं डेफिनेटली, और आर्ग्यूमेंट्स होते हैं उस पे, और फिर
Mhm.
रिलेशनशिप्स डिस्टर्ब होते हैं, आइदर इट्स अ क्लाइंट एंड एम्प्लॉय रिलेशन, इट्स मदर एंड डॉटर रिलेशन, एवरी रिलेशन. सो as Fatma said about gratitude journal, I give this task to my client every time. जिस रिलेशनशिप में मसला है, बैठें और सोचें कि उसके बारे में 5 अच्छी चीज़ें शायद उन्होंने आज आपसे कहा हो कि बेटा आज आप मदर के यहाँ अगर आपने जाना है, फॉर सपोज़ मदर इन लॉ एंड आप बहू का रिलेशन है, आपने मदर के यहाँ जाना था और आपकी सास ने, मदर इन लॉ ने आपको नहीं रोका. दिस इज़ अ
Mhm.
ग्रेटफुल फॉर यू. यू शुड बी ग्रेटफुल फॉर दिस मोमेंट, राइट?
Mhm.
हमें ग्रेटफुल होने के लिए कुछ बड़ी चीज़ें नहीं चाहिए. आप छोटी-छोटी चीज़ों पे ग्रेटफुल होना फ़ील कर दी शुरू कर दें, राइट?
Mhm.
आपके बच्चे ने कोई डिमांड की किसी खाने के लिए और आपकी फ्रिज में वो चीज़ें थी और आपने फ़ौरन बना के दे दी. यू शुड बी ग्रेटफुल फॉर दिस. इससे होगा
Mhm.
क्या? You will start thinking about positive things in life, and you will only see the positive aspects of life, and you will stop seeing the negative things in life, राइट? और
Mhm.
जब नेगेटिव, ऐसा नहीं है कि आपके जहन से नेगेटिविटी ख़त्म हो जाएगी या आपको गुस्सा नहीं आएगा या आपका इमोशंस जो हैं वो डिस्टर्ब नहीं होंगे, सब
Mhm.
कुछ होगा, बट योर माइंड, अनकॉन्शियस माइंड गिव्स दैट मेमोरी जो अभी आपने पॉजिटिव ग्रेटिट्यूड्स करके अपने माइंड में स्टोर की हैं 1 ईयर में,
Mhm.
1 मंथ, वो एज अ प्रूफ्स देना शुरू कर देगा कि यू आर अ ब्लेस्ड पर्सन, क्या क्या चीज़ें हैं आपके पास. सिमिलरली अगर कोई भी फिजिकल प्रॉब्लम्स हैं, ब्रेस्ट कैंसर से आप लड़ रहे हैं, ठीक है, आप मेंटली वीक होना शुरू हो जाएंगे, मेरे साथ ऐसा क्यों हो रहा है, मेरे पास तो फाइनेंशियल रिसोर्सेज नहीं है, बहुत सी चीज़ें अवेयरनेस होने के बावजूद बहुत सी चीज़ें आपको मेंटली डिस्टर्ब करेंगी. ये
Mhm.
फाइनेंशियल जो है अगर मेरे अपने हेल्थ पे लग गए तो मेरे बच्चों का क्या होगा, मेरे हस्बैंड्स का क्या होगा, राइट? बट व्हेन यू स्टार्ट ग्रेटिट्यूड, ओके, तो आपका माइंड पहले तो शुक्र अदा करेगा कि ये भी है, थैंक यू कि मुझे अवेयरनेस हो गई. अवेयर ही
Mhm.
नहीं होता तो फिर क्या होता,
Mhm.
अवेयरनेस अगर मेरे पास नहीं होती, राइट? जब आप रिलैक्स मोड पर जाएंगे आपने फिर उसके बारे में स्टेप्स लेना स्टार्ट कर देंगे. तो सेल्फ केयर आपके सेल्फ लव से स्टार्ट हो रही है, और सेल्फ लव आपके स्टार्ट हो रही है कि आप अपने आप को प्रायोरिटी पे रखते हुए अपने माइंड को रिलैक्स कर रहे हैं. माइंड को रिलैक्स करने के लिए एक हम ग्रेटिट्यूड बहुत ज़्यादा स्टार्ट करते हैं. जब ग्रेटिट्यूड होते हैं, अपने आप को ब्लेस्ड फील कर रहे होते हैं हम, माइंड के पास पॉजिटिव स्टोरेज डेवलप हो रही है. अब रिलेशनशिप में किसी भी रिलेशन, हस्बैंड से प्रॉब्लम स्टार्ट हुई, माइंड ने प्रूफ
Mhm.
देना शुरू कर दिया कि इसके बारे में तो आपने खुद इतनी अच्छी अच्छी बातें की थी. तो जब वो सेल्फ को इन अंदर से आने लगती है चीज़ें, आपको इनर फील होने लगता है, जब इनर प्रूफ्स मिलने लगते हैं आपको, आउटर प्रूफ्स जितने मिले हम एक्सेप्ट नहीं करते, राइट? बट
Mhm.
जब इनर
Mhm.
प्रूफ्स मिलते हैं अल्टीमेटली वी एक्सेप्ट इट.
Mhm.
तो जब वो एक्सेप्टेंस आना स्टार्ट हो जाती है तो एट द सेम टाइम हम जो है वो हमारी चीज़ें बेटर होना शुरू हो जाती हैं. फिर वो या तो हमारे हेल्थ हों या हमारे रिलेशनशिप्स हों या हमारे फाइनेंशियल इश्यूज हों, राइट? क्योंकि
Mhm.
माइंड जब रिलैक्स पे जाता है, माइंड फिर आपको सॉल्यूशंस दिखाना शुरू कर देता है.
Mhm.
अल्टीमेटली यू गो आउट फॉर अवेल दिस सॉल्यूशंस, राइट?
Thank you so much. I before I pose one question for Anila, as we are also keep on discussing about the cancer issues and sort of like early diagnosis and the other stuff in that. So as I mentioned that I'm gonna ask some questions from Dr. Sarah in regards for a mammogram. When should we go for it? Types of breast cancer or the common type of cancer, breast cancer, and what could be the early signs? As like I've also now, because of the awareness, we know that we can do the personal checkup as well, like, check ourselves that, yeah, if we are just checking under the arm like a sort of lump or anything, of course then there would be a sort of a doubt that we are developing with that lump or a sort of a tumor, then we definitely have to go for a mammogram and stuff. So, and is it hereditary or not? So there are a few questions. So from where you want to start, please go ahead. Mike is yours. Mike is muted.
Sorry, I,
No problem.
it's fine now, I hope.
Mm,
So,
yeah.
yes, these are very important questions for all those who are watching. So, we were discussing just before this the modifiable risk factors of breast cancer, and at that moment, I just left it there, but there are certain non-modifiable risk factors of breast
Mhm.
cancer as well, and which include being a female. Obviously, like we discussed, 99% of the cases are amongst females. Men just suffer from 1% of the cases. Then increasing age is a very important factor. Though in Pakistan again, younger age groups are equally affected, but as the age increases, there's an increased risk after the age of 70
What?
years of 4% every decade, right?
Okay.
So that is one risk factor. Then there are genetic
Isn't
mutations like
it? Sorry
BRCA1
to
and
interrupt you,
BRCA2.
doctor. Sorry to
Mhm.
interrupt you because I'm also interested for corrective. Isn't it from 40 we should consider, or you said after
Yeah,
70? Or I missed it.
no, I just said that after 70,
Uh
every
huh.
decade, 4% risk
Oh,
increases.
okay. Okay. All right. Right.
But yes, when we come to mammogram and screening, then we discuss that at what age you should start,
Mhm.
evaluating yourself.
Right.
And
Please
apart from
continue.
that, like we discussed the BRCA1 and BRCA2 genetic mutations. The family needs to be, get tested. It is little expensive. We don't offer to every patient, but in where the family history is strong, like in every generation or more females have been affected. In Pakistan now we are also offering the genetic testing for breast cancer as well as other cancers. Then there
Hmm.
are certain risk factors like early menarche in women, in girls these days that we are seeing, or late menopause, and even the first stage at childbirth, if it is 30 years or more, that is a documented risk factor for the development of breast cancer. Apart from that, the use of oral contraceptive pills or hormone replacement therapy, if you use them at a stretch for 2 years or more, they increase your risk of developing breast cancer.
Hmm.
Also, I want to clear one confusion about breastfeeding.
Yeah.
People say that they have
I
breastfed.
we all sorry to interrupt again. I was also feeling a bit like, we are a shy community. We do not openly discuss these issue or these things, but we have to bring up the benefits, like, which are sort of cultural or sort of natural things. So please carry on for that. Sorry to
So
interrupt you.
it is said that it breastfeeding for 2 years is protective against breast cancer. However, now we notice that even there are women who have breastfed children, two children or more children for more than 2 years, but they still develop breast cancer. So breastfeeding does not mean that it will protect you forever against breast cancer. Yes, there
Hmm.
is some sort of protection. Still,
Hmm.
women who have breastfed may develop breast cancer. So, when people come and they get
Hmm.
diagnosed, again, there's a phase of denial. Like, how can I get breast cancer? I fed all my kids. Maybe the reports are wrong. Maybe the doctor is saying whatever the doctor is saying is wrong. But no, they need to accept, because until and unless they accept the fact that they have cancer, they will not be able to move on towards the treatment phase. Then you asked me about the symptoms, the common signs and symptoms.
Hmm.
So when we talk about breast cancer, we consider breast and the armpit as one part. For the
Hmm.
general audience, I would like to tell them, because 20% of the times there is no symptom in the breast. However, there is a lump in the armpit, or there is some thickening, or some skin change, or some color change in the armpit. So if somebody notices that, then they need to go to the doctor and get themselves evaluated. So lump is obviously presence of a lump in breast or armpit is the most common sign or symptom of breast cancer. Breast lumps, the cancerous lumps are mostly they are painless, right? So that is why people cannot pick them up at an early stage. They
Hmm.
only cause pain when the cancer has eroded the skin or has spread in other part of
Oh.
the body. Other than that, it's a painless lump. It's kind of like a silent killer,
Mhm.
right? Then
Mhm.
any skin color changes, any dimpling of the skin in the breast or the armpit, or any any small nodules or any color discharge from the nipple, especially if it is red in color, you
Yeah,
must
like bleeding.
always go to your doctor. Your doctor is going to examine you, evaluate your history, order age appropriate investigations, and then you move on in some direction. Then,
Mhm.
what investigation to get done, and when should you
Mhm.
start going to the doctor? So, since I told you that in Pakistan, the number of cancer cases is increasing, and we are getting the disease at a very young age, we follow the WHO guidelines. WHO guidelines say that women who have reached the age of 40 years and above,
Yeah.
they must
Mhm.
get their mammograms done once every year,
Mm, right.
right? So this is
Mhm.
for the average risk population. Average
Right.
is those who do not have a family history, or those who do not have more than two risk factors, maybe, or more than one risk factor. But then there
Mhm.
is a high risk population where there is genetic mutation in the family, or if
Yeah.
there's a positive family history of personal cancer, or anyone else in the family being affected. Those are at a higher than average risk. And then certain
Mm.
times there are more risk factors in a patient. So if that is the case, you need to go to your doctor at least at the age of 30 years. The
Mhm.
doctor again, they'll take your history, they'll examine you, advise you investigations, and then they'll tell you that you follow up with us after like every year, or maybe after every 2 years, and then after the age of 40. Remember, the age of 40, every year you must visit the doctor, you must get your mammograms or ultrasounds done. One more important thing over here, I would like to talk about the importance of the self breast examination.
Yeah.
We tell people that starting at the age of 20 years, because why 20? In the Western world, they say usually 25 years, at the age of 25 years, but I recommend people, and we here in Pakistan, that starting at the age of 20 years,
Mhm.
every woman must examine herself once every month. You do not
Mm.
need to examine yourself every single day or multiple times in a day, but just
Right.
once a month. And when that once a month is, those who get their period, at the end of
Mhm.
the period, the very next day, they must examine themselves. Takes hardly 5 to 7 minutes when they go into shower. They need to, just take off their shirt and first evaluate, see in the mirror, and then examination videos are all over the YouTube and internet. They must see and practice that every single month. And those women who are post-menopausal, or those who don't get their period, they must select one certain date every month, like for example the first of every month, and then
Mhm.
they must still, till they have they're alive and they're living, they must examine themselves once every month, starting at the
Mhm.
age of 20 till the time you have your life. Once someone's self-risk examination is very important, because when once we start examining the normal self, the normal
Mhm.
part of our body, God forbid if somebody develops subabnormality or notices some change in their breast or their armpit, then only will be able to pick it up and go to the doctor.
Right.
And then once you reach the age of 40, remember that is when the time period, the alarm begins, and you must visit the doctor, symptom or no symptom. You need to go get yourself evaluated and get your scans done early.
Thank you so much for this whole information, and I hope that it will be very valuable for my audience. And thank you so much for sharing that. Okay, coming back to Anila. Uh, as a psychologist, what do you see? I mean, like, again, we are talking about, we are discussing about self love,
Kiran,
self
I'm cutting
care.
you. अजान हो रही है। किरण, इधर अजान हो
Sorry,
रही है, so I cannot speak. अजान हो
no
रही है यहाँ
problem.
पे।
Okay, no problem.
ठीक है, तो
Yeah.
आप अब you can ask somebody else, then फिर हम बात करते हैं।
Okay, sure. Okay, I can continue again with Dr. Sarah about like suppose some tumors are like benign, and like when suppose if we've got to know that, yeah, there is an issue, then again there is a sort of test that we will take some sort of tissues from those tumors, and then gonna go for some sort of testing as well. So please discuss a little bit about that as well.
Alright, sure. So the word tumor, like you just mentioned, tumor means a mass of cells. So it
Mm-hmm.
can be either benign, that is harmless, or it can be cancerous or malignant.
Mm-hmm.
Only testing tells us that if a tumor is benign or malignant and what type of a cancer it is if present. So when somebody comes to our clinic with a lump in the breast, we call it a triple assessment evaluation. That is, the doctor will take your proper history, examine you. Then according to your age, the doctor is going to advise you ultrasound or mammogram or both or maybe MRI as per the need, right?
Mm-hmm.
Once you get that done, people are very scared when we, mention the word mammogram because they think now since the doctor have advised us to get a mammogram done, now definitely something will come out wrong in the investigation, and they avoid that. No,
Yeah.
mammogram is very important, and let me
Yeah.
emphasize on the fact that anything that you feel on your hand, it is almost around. It has to be around 2 centimeter in size to be able to be appreciated on your hand. Mammogram is one investigation or ultrasound, they're so sensitive that they can pick up the cancer even before it comes into a proper shape or into a lump that is palpable on your hand. In
Mm-hmm.
the Western countries, screening is so it's so important and it is so efficient that majority of the cancer cases get picked up on mammograms or ultrasound. So they're very early stage cancer. The patient gets treated early. The morbidity, the mortality is less. The mental trauma that the family and the patient go through is obviously much lesser, and the cost of the treatment is again very less. This is very important in a country like Pakistan where we have severe financial constraints. Even if it's a
Yeah.
common disease like diabetes, the others would agree with me that the treatment is very costly. The insulin that comes is costly. Talk about a disease like cancer, it needs millions of rupees too.
Mm-hmm.
So, if it gets diagnosed early, you are able to, help patients cut the cost, prolong the life, make a better survival. Then I was just discussing that history examination, mammogram, and the third thing is biopsy. Now,
Mm-hmm.
again, people have a lot of issues with biopsy. They would come to us in clinic and they would tell stories like, oh, somebody in our relatives got the biopsy done, and because of biopsy, the cancer spread in the entire body. This is wrong. This is a misconception because
Yeah.
the picture in the hand can tell us one story, but to confirm the disease, to find out which type of cancer it is, because like we generally talk of a broader term, breast cancer, but breast cancer has a lot of types. It has a receptor, hormone receptor statuses as well. So unless
Mm-hmm.
we get the biopsy done, we will never be able to find out what kind of a cancer is it, what kind of medicines, what kind of treatment will be effective for this cancer. Because nowadays on biopsy, we even pick out the hormonal status. So that is really helpful. Please, if the doctor advises you biopsy, don't shy
Mm-hmm.
away from it. Get it done because without that you cannot move ahead. That is not just a
Yes.
part of the diagnosis; that's a part of the treatment as well. Then
Definitely.
you just asked me one important thing that what kind of cancers can be dangerous or not dangerous. See,
Mm-hmm.
uh, generally considered that hormone triple negative hormones when it's present in a cancer, they don't have a good prognosis. Hormone receptor positivity is considered to be have a better prognosis as compared to the triple negative breast cancers. And then there are a lot of other factors. Again, this will we go much into the details of the medical terminology. So just for the for sake of it, I'll keep it till here.
Sure, thank you so much. Okay, after that, I would also come back to you for a very important question. Now, this have been diagnosed that somebody got a breast cancer. What are the treatments and what could be the therapy? And again, I would go back to Fatima after Anila as well, like, what therapies or what sort of meditation or exercises she offers, for self care. And last question would be from Mahvish. But before that, Anila, as I wanted to ask you something, what I was talking about self care, self love. Is it something like, when we say some science, when you as a psychologist notice in your clients that, yeah, there is something wrong? Okay, because when a lady would come as a client, and she would show a sort of a stress or anxiety on her face, and you might be noticing those things, you can tell better. But what could be those signs of burnout, that, like, yeah, somebody is suffering or dealing with burnout, and she, even though not accepting it, that yeah, she is, like, in a sort of a situation in a burnout, and then she doesn't know how to deal with it. And one more thing is something, when we uh, say for a sort of ladies, when they be in a sort of a confusion, in a sense that they always think that yeah, they would always be confident, and they would say, oh, we are so strong, but they have a sort of self doubts as well. Oh, we are not strong enough, we can't do this, or we can't say, as one minor example of saying no, if we will say no, so then other people, they will mind it, or they will think that we are selfish. So again, for burnout sign, again, for women to feel that she is not strong enough, how to deal with all these things, please go ahead. Mike is yours. Anila, are you with us? I think she is struggling with her internet. Can you hear me, Anila?
No, no. I think you are going and coming. Can you hear me, Kiran?
Yeah, yeah, I can hear now.
Am I audible?
Yes, you are.
Okay. So I think there's some issue with the net all the time. It is
Oh,
happening.
okay.
So I think there's something else which, and I also have some question for our doctor as well. I hope she can answer my
Sure.
question because I felt the need
Definitely.
of those questions and people don't know how to. I'm not saying that, but when you are, when you know how to ask the right question in terms of so what people will do, for example, like you're talking about the self-care. Again, the concept of self-care, the concept of burnout, the concept of looking out for yourself, and the concept, like in terms of when you're growing up and when you were young, let's say there was one thing, and we used to hear this all the time, that when you get married, you're going to get this in your life. People will take care of you, your husband will take care of you, your husband will take care of your everything. And before that, uh, the father is doing everything or the mother is doing everything. So women are growing as as a dependable mindset, like they're growing a dependable mindset, like they have to depend on other
Mhm.
people. For example, if I want something for myself from my husband,
Your voice is
what
breaking.
will be the
I'm sorry, Anila, your voice is breaking, but I'm still waiting.
Am I audible now? Because I have to change the
Yeah,
router. Can you hear me?
sure.
Okay. So when
Yeah.
we are growing up as a female, we are rewarded on our behavior when we are dependable on other people. Like when you're dependent on parents, like I was talking about, like market is hardly maybe 1 or 2 minute walk from my house, but I have to wait for somebody to come and bring something for me. And it also
Mhm,
include
mhm,
cooking. Like for example, even if I need salt, I have to wait for somebody to come from outside, and then they will get the salt. I cannot go outside. So I'm just giving you an example like that is a rewarded behavior. Oh, she's a very tabedar bahu, in terms of कि बहू सास का वेट कर रही है और उस तरह से कर रही है. So the thing is that when you're growing up with this mindset,
mhm,
it look like that as a female we have to serve other people.
mhm,
यानी कि माँ की जिंदगी खत्म हो जाती है बच्चों को बड़ा करते करते, हस्बैंड की बातें सुनते, उसके साथ काम करते हुए. एंड आई एम नॉट इवन फाइटिंग अबाउट द रोल दैट वी हैव एज अ फीमेल इन आवर सोसाइटी, या दुनिया में हमारा क्या रोल है, बट आई एम जस्ट टेलिंग जिसके माइंडसेट है क्या. अब उसमें अगर आपको कोई लड़की लगती है जो इंडिपेंडेंट है, अ, खुद फैसला कर लेती है, खुद कुछ कर रही होती है, can you believe that not just male but female are also feeling threatened from that woman, and
mhm,
they are saying
mhm,
that कि ये तो बहुत बेबाक सी है और बहुत मुंह फट सी है और इस तरह की है और इस तरह की है, ये कर रही है वो कर रही है. So I'm just telling one thing, that if somebody is independent in their own thinking and their action and their decision making, this is also
coming from the core of not just confidence but self-care, that you have to take care of yourself by yourself. People don't have to take care of you. You know, there's one question which I would which people have, and there's this fear as well, that what is going to happen with my children when we die. I'm talking about coming from the special parent background. They always think about that, and yet they are not teaching their child that how to do self care, how to be independent. You know, so when we talk about other people, like as a female, you growing up, you cannot do your own decision. Let's say you have to wait for, and like there are things that giving this the concept of giving the confused uh, narrative of self care, that go to this salon and somebody else will pay for you. So the mindset of people taking care of you is taking the whole idea of you taking care of yourself. You know, like this is a very confused thing maybe, but because we are grown up like that, ये idea तो होना ही नहीं चाहिए हम लोगों को. हम तो खवातीन हैं, हमें तो दूसरों के ऊपर डिपेंडेंट होना है हर तरह से. हमें तो डिपेंडेंट होना है कि जब फलाना बंदा बाहर से आएगा फिर हम खाना खाएंगे. यू नो, और हो सकता है फलाना बंदा बाहर से आए तो वो खाने का टाइम ही निकल जाए. लोगों के हेल्थ केयर इशू, जैसे हमारी वो एक और फ्रेंड है जो योगा करती हैं, अगर वो अपना खाना टाइम पे नहीं खाएंगी तो डोंट यू थिंक दैट
She
इज
will
गोइंग
suffer with
टू मेस विद हर. Yeah, like because she's going
100%.
through diabetic, insulin बहुत जरूरी है उनके लिए. So having this thing now, like you were talking about the burnout होता क्यों है? Despite we taking care of ourselves, हम अपना टाइम रख रहे हैं, खाना टाइम पे खा, सब कुछ करें, बट क्योंकि हमने सोचा हुआ है कि मुझे ये काम करना ही करना, जब तक फलाना बंदा नहीं आएगा तो ये लोग नहीं खाएंगे, मैं खाना नहीं खाऊंगी, इस ऐसा नहीं होगा, तो ऑटोमेटिकली जो हमारे रोल हैं जो कि बहुत ज्यादा कंफ्यूज हो जाते हैं और हमें हर टाइम प्रेजेंट रहना होता है. और समटाइम फीमेल डोंट अंडरस्टैंड दैट टेकिंग केयर ऑफ अदर पीपल डज नॉट मीन कंट्रोलिंग देम. सो वो उस चीज में कंट्रोल भी लोग कर रहे होते हैं इन टर्म्स ऑफ मैं खुद खाना दूंगी, मैं जब आऊंगी फिर मैं खाना डाल के दूंगी, किसी ने खाना नहीं डालना है. सो ये हम रोल यहाँ पे कंफ्यूज करें. जहां तक बर्न आउट की बात आती है, व्हेन यू आर गिविंग टू मच टू अदर पीपल and you know that we're not getting that back. We are doing this in friendship, we are doing this when we are growing up as a girl, because क्योंकि सबसे अच्छी लड़की वही होती है जिससे सब खुश होते हैं, जो कि सबकी बात मानती है, जो कि फर्माबरदार होती है. और ये बड़ी अच्छी बहू की निशानी, अच्छी बेटी की निशानी है, स्ट्रॉन्ग वुमेन की निशानी है कि उसने सिर्फ अपना ख्याल नहीं रखना, तो उसे सबका ख्याल रखना होता है. फिर वर्किंग वुमेन है, बड़ी स्ट्रॉन्ग वुमेन है कि वो लाइफ को भी लेके चल रही है, बच्चों को भी बड़ा कर रही है, उनको भी संभाल रही है और कैरियर भी मेंटेन कर रही है. तो हमने जो ये स्ट्रॉन्ग वुमेन का जो लेबल लगाया हुआ है ना एक चीज के ऊपर कि वुमेन शुड बी स्ट्रॉन्ग, वी वांट वुमेन टू कम फॉरवर्ड, वुमेन आगे जाती जा रही हैं और हजरात पीछे हो रहे हैं. लड़कों को कारनामे हमें सुनने को नहीं मिलते, कारनामे इन टर्म्स ऑफ कि उन्होंने क्या अचीवमेंट्स कर ली हैं. लड़कियां अचीवमेंट्स किए जा रही हैं, नंबर्स उनके आ रहे हैं, आपने उसको जबरदस्ती का रोल दिया हुआ है स्ट्रॉन्ग बनने का. And why I'm saying this is that leads to burnout. हम burnout की हमें कैसे पता चलेगा हम burnout हो रहे हैं? जब कोई भी कंडीशन लॉजिकल हो जाती है. ठीक है, जैसे हमारी जो यहाँ पे वो हैं स्पीकर हैं जो कि योगा की बात करेंगी, she can relate to that as well कि माइंड बॉडी का कनेक्शन ही नहीं है और हमें समझ नहीं आ रही कि हमें जो कंडीशन है, हम जिस चीज से गुजर रहे हैं, वो बर्नआउट तक लीड कर रही है. अब बर्नआउट इन टर्म्स ऑफ फूड, जितने भी हमारे एरियाज ऑफ लाइफ है वो अफेक्ट होना शुरू हो जाएंगे. एंड सबसे पहली चीज तो यू आर गोइंग टू डॉक्टर, आप ठीक नहीं हो रहे. आई नो पीपल टेस्ट पे टेस्ट करवाए जा रहे हैं, वो एंडोस्कोपी करवाए, 2-3 एंडोस्कोपी करवाई हुई है, स्कैन करवाए हुए हैं, दांत का स्कैन हो रहा है, आइस का स्कैन हो रहा है, अपने आप को इतना कुछ सब्जेक्ट किया हुआ है और सेटिस्फाइड आप सिर्फ एक दवाई से हो रहे हैं. यानी डॉक्टर कह रहा है ठीक है, फिर 2 महीने बाद आपकी कॉल एंजाइटी आ जाती है कि मेरे यहाँ पे कुछ हो रहा है, मेरे वहां पे कुछ हो रहा है. सो इट मीन्स दैट योर ब्रेन इज प्लेइंग विद यू एंड दैट इज अ क्लियर साइन दैट यू आर गोइंग टुवर्ड द बर्नआउट स्टेट. आपके सारे एरियाज ऑफ लाइफ मुतासिर होना शुरू हो जाते हैं. यू गो टू डॉक्टर एंड डॉक्टर भी से आप बिल्कुल ठीक है, सिर्फ स्ट्रेस है, पैनिक अटैक्स जैसे फॉर एग्जांपल अगर आप करते हैं. एंड आई हैव सीन पीपल एंड दे हैव लिटरली like reported that कि even ECG was clear when we went to doctor और हमें अपने दिल की धड़कन सुनाई दे रही थी. बीपी was okay, थोड़ा सा बीपी ऊपर नीचे आया था, वो तो आपको पता होता ही है. बट whenever you feel like that, you are not okay in your body, you're going to doctors, you're taking medication, you're not getting right from that. आपकी एजुकेशन खराब हो रही है, आपके जॉब परफॉर्मेंस खराब हो रही है, आपकी हेल्थ खराब हो रही है. सो दीज आर क्लियर साइन ऑफ स्ट्रेस. आपकी स्लीप डिस्टर्ब हो रही है, वेट गेन बहुत ज्यादा हो गया, वेट लूज हो रहा है आपका, स्लीप बहुत ज्यादा होगी, स्लीप बहुत कम होगी है, या खाना कम खा रहे, खाना ज्यादा खा. मतलब ये कि मेरा पॉइंट ये कि पहले आप कुछ और थे, आप कुछ और हो गए. पहले आप खाने एक सर्टेन अमाउंट में खाते तो आपने खाना कम कर दिया है. एंड सम टाइम अगर आपका सडन वेट लूज हो रहा है तो इट्स नॉट अ गुड साइन एक्चुअली. यू नो, आप खुश हो रहे हैं कि आपका वेट लूज हो रहा है, यू आर नॉट अंडरस्टैंडिंग दैट यू आर गोइंग थ्रू समथिंग वेरी बैड इन योर लाइफ. यू नो, एंड हम एक चीज कहते हैं कि ये एक इंसान जो है पहले बहुत खुश मिजाज था, उसका मिजाज चेंज हो गया है, लोगों से मिलना जुलना छोड़ दिया है, या अपने आप को सारा टाइम वर्क के पीछे छुपा लिया, वर्क हॉलिक बन गया है. सो यू वुड सी द क्लियर चेंजेस इन योर सेल्फ. और जितने भी एरियाज है, वो चाहे पर्सनल लाइफ है, चाहे एजुकेशन है, चाहे फैमिलियल लाइफ है, फैमिली के साथ है, चाहे ऑक्यूपेशन है. सो दीज आर द ऑल थिंग्स विच इज क्लियरली द इंडिकेटर ऑफ. या इसको आप मुझे मेरे सामने एक स्माइली फेस बनाने की जरूरत भी नहीं, ये शुरू करेंगे ये हुआ है, मेरी लड़ाइयाँ हो रही हैं, कुछ ठीक नहीं हो रही, मुझे बहुत उसके बाद में लड़ाई हो जाती है, ये मसला हो रहा है. सो दीज आर ऑल साइन आपके जितने भी फंक्शन है दैट इज डिस्ट्रक्टेड. और स्ट्रेस आप ऊपर बर्नआउट की स्टेट आती है तो वो डेफिनेटली आपकी इट्स काइंड ऑफ दैट इट इज गोइंग टू प्ले विद योर फिजिकल हेल्थ. नाउ मेंटल तो थी, अब आपकी फिजिकल हेल्थ. एंड यू नो दैट वंस यू आर और आपको पता है कितनी कंडीशंस हमारी हैं जो कि साइकोलॉजिकल इंड्यूस होती हैं फिजिकल कंडीशन से. स्टमक खराब आपको हो रहा है, लेट से न्यूरोलॉजिकल डिसफंक्शन आपको स्टार्ट हो गया, ब्रेन फॉग स्टार्ट हो गई है, यू नो, आपका लिवर सही तरीके से फंक्शन नहीं करा, किडनी में इशू आना शुरू हो गया. सो आपकी जितनी भी साइकोलॉजिकल कंडीशन तो फिजिकल कंडीशन में होना कन्वर्ट होना शुरू हो जाती हैं. एंड मिग्रेन्स आपको होना शुरू हो जाते हैं, यू नो, लाइक सर में दर्द हो रहा है, मुसलसल सर में दर्द रह रहा है, आपका बीपी कंट्रोल नहीं हो रहा. तो दीज आर ऑल द स्टेट. यानी कि आप कहेंगे मैं खाना बिल्कुल ठीक खाती, मैंने नमक नहीं खाया डाला था, फिर भी मेरा बीपी तेज हो गया है, या मैंने टाइम पे खाना खाया था, मैंने एक्सरसाइज की थी, इवन स्लोली एंड ग्रेजुअली आपकी एनर्जी आहिस्ता आहिस्ता कम होती जाएगी. सो दीज आर द स्टेट ऑफ बर्नआउट. इधर एंजाइटी की वजह से हो रहा है, डिप्रेशन की वजह से हो रहा है. और हर दफा ना आपको स्ट्रेस की, डिप्रेशन, एंजाइटी की जरूरत नहीं होती. देयर आर सो मेनी थिंग्स दैट you are going through, and that is the state of burnout. So I think I just tried to
Thank you
clear
so
lots of things out
course.
here.
Thank you so much. Thank you so much for that. And I would, with one point, definitely I would agree with you. Sort of a like, sudden weight loss. People, they think, oh, we are, reducing weight, and then it's a sort of a good sign. But actually, it's a reduction of the bone density as well. Doctor can tell more on that. But now if I pose question, and first, before I want to go to doctor or Mavish, I love the posture of Fatima. The way she is sitting, it's a beautiful posture, and it is sort of like yoga. Even though during session she is doing this posture just to show us that she is calm, she is relaxed, she is enjoying the time. And every time when people they enjoy, that's the sign of like the way Fatima is showing. So I would definitely would like to give mic to Fatima. It is something like now I want to put few things here. Now let's suppose burnout is there, ladies are like too much stressed now. Anila showed the science also of burnout, meaning like they are having struggle, like putting a lot more burden, overburdened, a lot more responsibilities, and fully loaded with the stress, with anxiety. Now we are talking about therapies. Somebody came to you and she really want help. What therapies would you like to offer to them? What are the chances, how many percent chances that they would go towards the sort of positive side for in a sort of meditation or other therapies? You are going to tell me, but initially would you be struggling, or the patient will be struggling, or a client will be struggling, yeah, that this is happening. And sometimes you would also see the disappointment that, yeah, they did come to you, they joined you for 2 months, after that you didn't see them. And when you inquire that, they said, oh, nothing is happening, no positive change, and then that's the reason that we are, we are quitting. How do you see it? First thing, therapies, again, like, a little bit about from your clients view, how do they take it? Yeah, please, Mike is yours. What would you like to say on this?
Okay. Thank you so very much, Kiran, once again. Okay. So first, I'm going to tell you few things which can help in every situation. Let's suppose I am diabetic, or let's suppose we are talking about other any particular condition, cancer है या कोई भी दूसरी चीज है. So first, we need to calm ourselves. Okay, so before acceptance, we need to calm ourselves, and for calming ourselves, I'm sitting as a in a normal cross-leg position that is called the Sukhasana in the yogic language, right? And here I am going to join this. This is the yogic mudra, and I'm joining this my first finger with my thumb, and I'm joining this both. And this is for the calmness. I'm just keeping my both palms on my lap, and I'm just sitting with the straight spine, straight back, and just close my eyes and deep breaths. So initially, for calming our body, the most easy and the very effective method, that is 8-4-7 method, or sometimes box breathing. What we need to continue with, just inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and again hold for 4 seconds. We can continue this box breathing for three cycles, for 4 cycles, or sometimes for 5 cycles. It depends कि आपका जो माइंड है वो कितनी देर में काम होता है. Just with the help of deep breathing, you can calm your nervous system very easily. So it's the main thing to calm yourself first, and then you need to continue with the other things. But definitely before sitting, coming in the sitting, this posture, you need to continue with few things as well. That is the shoulder rotation, which I'm going to show you. And this is something like that. Simple. It's a normal shoulder rotation. If you people want to follow this, you people can follow this as well. Just do continue with a simple shoulder rotation, and then come back. वापस आएंगे. Again, so 3 times, 4 times, and then slowly continue with the neck rotation. And all these things, when we are doing them, that those particular moments connect ourselves with our body and make us mindful. Okay, yeah, we need to turn this, we need to look down, we need to move our back, or something like that. And then we need to continue with the breathings. So when it comes to the mental health counseling, or counseling and the therapies, we do counsel with the different activities to them. The paper activities, painting, coloring, making a paper ball, crush the paper, tear the paper, and just we are here to listen them. We all want them to just vent out first, because अगर वो मुझे पूरी बात नहीं बता रहे हैं तो मैं जो भी बोलूंगी वो उनके अंदर नहीं जाएगा. So we need to empty the glass first, and then we can pour something else into the glass, into the same glass, right? So we continue with the vent out initially in the first stage, and then we continue with the talks, and along with those particular exercises and therapies, along with the meditation, along with the gratitude journaling. But there are some cases in my life which I have dealt with, and there are many cases in this universe like that. There are some people who need TREs. TREs are the trauma and tension releasing exercises. So first we are considering them with we cater them with the talks, with the normal and easy activities, which can do continue with the table, sitting on the table with the gratitude journaling. But when we feel someone, like, let's suppose you said that, so you have done with 2 session or 3 session, or as you said 2 months, but हम इतना नहीं लेके जाते. 2 or 3 sessions के बाद ही हमें पता चल जाता है कि that person need to go to the TREs, or we need to continue with some other strategy. तो sometimes लोग वाकई सिर्फ बात करने से ठीक नहीं होते. Sometimes लोग वाकई सिर्फ समझाने से या उनकी बात सुन लेने से ठीक नहीं होते. Most of the people हो भी जाते हैं, but some people really need special and particular treatments for that. So then after 2 session or 3 session, we realize that that particular person need TREs, and we just go with that particular pathway. उसमें हमारी बॉडी की डिफरेंट एक्सरसाइजेस होती हैं, डिफरेंट, जैसे आपने सुना होगा when we are tapping our body, just a simple tapping. So when it comes to the stress, जैसे just मैम just told us कि वो आपकी जो स्ट्रेस आपका सिर्फ दिमाग में नहीं होता, वो आपकी फिजिकल बॉडी पे अपेयर होना शुरू हो जाता है. टेस्ट सारे क्लियर आ रहे हैं, लेकिन अगेन आपका टेंशन इतना है, आपके माइंड में सारी चीजें इतनी अक्यूमुलेटेड हुई हैं कि वो बॉडी के लेवल पर अपेयर हो रही हैं. So when it comes to this those particular stress signs or the anxiety or the depression, whatever we name them, they accumulated in our body. When it comes to the females, most of the time, when it comes to the female emotional traumas, they are accumulated in the female body around the mid area, hips, thighs, and the lower belly, especially when it comes to the stress or the tension that stores around the neck area. Some people really have a hump there and it's very visible. And this is not the thing. आपको उनको देख के ऐसा नहीं लगेगा that they are facing. They are living their life normally. घर है, बच्चा है, फैमिली है, मियाँ अच्छा कमा रहा है, खुद भी वर्किंग वुमन है, तुम्हें क्या टेंशन है? ना शुक्री मत कर. ये हमारी सोसाइटी के वो कॉमन जुमले हैं, वो कॉमन बातें हैं जो हम में से हर कोई, हम सारे जो है वो एक ही फील्ड से बिलोंग करते हैं. वी ऑल आर इन अ वेलनेस टू द कम्युनिटी, टू द मैनकाइंड. तो ये सारे जुमले हम सभी लोग सुनते हैं डिफरेंट फीमेल्स के थ्रू. दैट इज पर्टिकुलर थिंग कि आपकी लाइफ अगर दूसरों को नॉर्मल नजर आ रही है, इट डजंट मीन कि वो नॉर्मल है. मैं आपको सिर्फ एक अपना एक छोटा सा वाक्य शेयर करती हूँ. मेरे पास एक क्लाइंट थी एंड शी इज I'm not naming the organization and I'm not definitely naming that particular person because definitely it's a very trustworthy. एंड शी टोल्ड मी के फातिमा वो अच्छी खासी बड़ी ऑर्गेनाइजेशन चला रही हैं फीमेल्स की, यहाँ भी, लाहौर में भी, डिफरेंट सिटीज ऑफ पाकिस्तान में. And she has an abusive partner and she told me that Fatma, when I'm looking at myself in the mirror, I find those particular scars on my face जो मुझे initial days में hit करने में मिले थे. So although she is very successful, people are admiring their life, but what is she is facing at the back of their mind, nobody knows that. तो
Yeah.
पर्टिकुलर चीजों के थ्रू, पर्टिकुलर एक्सरसाइजेस के थ्रू एंड पर्टिकुलर टीआरईस के थ्रू हम ऐसी बहुत सारी चीजें कर रहे होते हैं. जैसे लेट्स सपोज अभी मैं आपसे सिंपल बात कर रही हूँ एंड दिस इज माय पोस्चर, दिस इज कॉल्ड द पावर पोज. तो ये छोटी छोटी चीजें हम अपनी लाइफ में एंटर करवाते हैं अपने उन लोगों के साथ जो हमसे कनेक्ट करते हैं एंड डेफिनेटली
Definitely.
इनका रिजल्ट आता है. अल्हम्दुलिल्लाह, शुक्र अल्हम्दुलिल्लाह. तो
Thank you
नॉट
so much.
100% आप ठीक हो जाओगे, बट या
Yeah.
सॉरी टू इंटरप्ट, बट या
No
50
problem.
to 60, 70, 80% रिजल्ट आता है. थैंक
I'm
यू सो
coming
मच
back to you.
किरण,
I'm
थैंक
coming
यू.
back to you
या
just because I want to ask one question or one or two questions as well. But doctor, she has to leave. So one last question I wanted to pose to her. Then of course we will let her go. But thank you so much for coming, Dr. Sarah, and it was an amazing session with you to highlight a lot more issues regarding or surrounding of breast cancer, issues or breast cancer awareness. Thank you so much for that. Last question, as I said it, that before that I also mentioned, what are the treatments, in med side? What would you like to offer from the med side for the patients in regards for breast cancer? That there are the therapies and there are like, sort of 80 to 90% chances that, yeah, there would be recovery. Please go ahead.
Thank you so much, Kiran, for
Sorry, Kiran,
having
I
me
would
over.
want to ask one question as well. Sorry. मैंने पहले भी कहा था. Please, can you hear me? I want
Yeah,
one.
you
Yeah,
can
अगर आप
yeah.
थोड़ा सा
yeah,
बता
you
दें
can
कि
pose
what
a
is that?
question. Yeah,
Yeah.
you can pose the question, then she will, yeah,
So I
respond.
wanted to know about, and people are not like talking about those things, कि जो periods हैं, PCOS हैं, like जो overall health है, like ovary और जो पूरा connected body है, थोड़ा सा आप इसका भी बताएं कि कितनी important है इसकी पूरी information, because people are not talking about that. Even people are not even comfortable to talking about their body image and body size and everything. You look like breast size and those things. Like मुझे idea है और शायद आपको खुद भी idea, बहुत से लोगों को idea होता है, लेकिन बोलते नहीं है. और कुछ लोगों को idea नहीं भी होता about the connection of the whole body, the whole you could say the cycle. So please आप थोड़ा सा इसके बारे में बता दें, because I know people don't talk about those
Okay.
things.
Okay. So thank you firstly, Kiran, for having me over. This is one topic where you can go and talk about a lot. There are multiple aspects to it.
Mhm.
I will take the first question first. The treatment modality, like we just discussed, there it's a multidisciplinary care. One
Mhm.
one doctor, one person cannot treat breast cancer. There has to be a surgeon involved, a medical oncologist, a radiation oncologist, a psychotherapist involved, because It's not just
Mm-hmm.
with the health and the financial trauma, it's the mental trauma that comes with it is also very, very important, not just for the patient but also for the family. And I think there should be support groups जो हमारे यहाँ कुछ hospitals में हैं, but there should be more of that. So where the survivors and the victims could come together and they could sort of offer help. Then the families are very important when we talk about it. The family must not just abandon the person who's suffering or the immediate member. They should always offer the support in whatever way possible they can. So treatment, there are surgical options where if the patient comes to us in an early stage surgery, early stage of cancer, we can offer them breast conservation surgeries as well. Breast cancer does not mean removing the breast once and all for all, but we can save the breast of the patient if the patient is
Mm-hmm.
coming to us at an early stage.
Mm-hmm.
Even after the removal of breast, there are a lot of surgical options available for breast reconstruction. So people need to know that because breast is a part of the beauty and aesthetic for a female. And
Mm-hmm.
females, they when they come to us, they say, "Oh, don't remove my breast." They don't want to get treated because they don't want to get their breast removed.
Mm-hmm.
So we need to teach them that no, breast reconstruction is possible, and if they're coming early, we can always save the breast. Then there are
Mm-hmm.
chemotherapy drug options. I think it's the most painful part of the treatment because there are side effects like nausea, vomiting, hair fall, and all these. But once the treatment is over, all the hair come back, the skin changes reverse, everything gets fine. Patients live a good, healthy life.
Mm-hmm.
Then there are radiation therapy, there are certain hormonal therapy. These are the other things. Every patient has a tailored treatment, not one treatment, fits
Right.
all. It's according to
Mm-hmm.
the type of the cancer that you have, the receptor status that you were having, as well as the stage of this disease. If it is a local disease, it's an early disease, or it's a late disease where maybe sometimes in stage 4 the disease has spread to other parts of the body as well. So the treatment is dependent upon that. Now, she asked me about PCOS and the hormones. See, the hormones, like I said, that the risk factors for development of breast cancer include early menarche, late menopause, and having the first childbirth after the age of 30. That is actually associated with that is linked with the hormone exposure.
Mm-hmm.
PCOS itself, if I talk about breast cancer, no, they are not a known risk factor for it. But yes, they can cause many other problems within the human body. Uh, the hormone status, and when the hormone status gets disturbed, you essentially develop bone pain, and there's psychological issues, there are cardiac issues, there are many other issues that come with ups and downs of the estrogen and progesterone hormones or with the PCOs that come along. It itself is not a known risk factor for breast cancer. However, hormone exposure definitely can, create different sort of problems in the health issues related to the health issues. And
Thank you
just
so much.
just quickly, Kiran,
Yeah,
just
yeah,
quickly
quick.
one
Yeah,
thing.
please go ahead. Yeah.
People say that we don't want to get mammograms done or we don't want to get biopsies done. Why? Because they think that biopsy is going to spread cancer in the body, or that mammogram is a very high dose CT scan or an MRI, and if they didn't have it before, after having mammogram, they will develop cancer. These all are misconceptions. Until we get the biopsy, we cannot move on. We cannot move ahead with the treatment. Biopsy does not spread cancer in the body. We need to preach that. And
Definitely.
mammogram is a very low dose radiation X-ray, and that helps in detecting the disease in a very early stage, even when there is no lump or no visible sign or symptom in the breast. So remember that early detection is the cure. Early detection is the prerequisite for complete treatment and survival.
Thank you
I
so
hope
much. Thank you so much.
I will
Thank you
end it
so
on
much
that.
for this. No, I must agree. I must say that, like, with all this information, with your presence, I would definitely say what I would try to put up this effort in regards for breast cancer awareness. And I think from our side, we did our job well. And for that, I would thank you so much from the bottom of my heart. And thank you so much. And we keep on doing a lot more shows and a lot more awareness sessions because like as an ambassador of mental health and physical health and personal care and sort of like other things as well, but and children and other issues, relationship issues, I bring up all this on my channel, and I keep on doing that. And for that, for the today's session, thank you so much. And now we can let you go, but next time I would
Thank
see you
you.
soon again for any other topic. I'll let you know. Thank you so much.
Okay.
Bye.
Goodbye. Bye.
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 All right. So I'm so sorry, Mahavish, if I take this last message from Fatma because she wants to leave as well. So then, yeah, it could be like last question, could be like last message, but I would give chance to Fatma because she also wants to leave. And then definitely Anila is my friend. She's always there for me. She knows. But thank you so much. Yes, Fatima, last message. What would you like to,
Oh,
yeah, say about
okay.
self care, self love? Please go ahead.
Okay, Kiran, thank you so very much, and thanks for the other two girls as well for listening me again because I have to rush for my this session at the Zoom definitely. Thank you so much once again for inviting me for this purpose, for this cause, for this awareness month of breast cancer. I just want to say that through your platform and through this podcast to everyone, just to take care of yourself and just to
Mhm.
love yourself. When we are starting loving yourself, definitely we would taking care of ourselves more, not only physical, not only mental, but overall well-being. Whether it's your diet, whether it's your exercise, whether it's your physical body, physical appearances, whether it's your mental health, whether it's your emotional health, initially and firstly you have to love yourself, because once you starting loving yourself, everything would be aligned. जब आप अपना अपने आप को प्यार करना शुरू करोगे, फिर आप अपने लिए अच्छा खाओगे भी. जैसे मैम ने बोला था कि जो मैं योगा वाली हूँ, आई डू टेक माई डिनर बाय 6:30 मैक्सिमम इन द इवनिंग एंड दैट्स इट. 5:30, 6:30 एंड दैट्स इट. एंड पीपल विल लाइक दैट के इस टाइम पे तो लोग शाम की चाय और स्नैक्स ले रहे होते हैं. दिस इज
In
माई
Pakistan,
डिसिप्लिन अकॉर्डिंग
actually,
टू माई
in
लाइफ
Pakistan,
in Pakistan.
only,
Yeah,
yeah, but not
exactly
in
in
Western world.
Pakistan.
Yeah.
So yeah, but maybe it's my habit for a long period of time. I do take my dinner really early because it
Wow.
really helps me to move actively throughout the day, not only in my body but in my mind as well. So there
Mhm.
are many small steps we need to take care just to love ourselves, to care ourselves, and just like you and just like most of the females here, spread the message of love and kindness and lots of love and respect for all of you. Thank you so very much.
Thank you so much, dear. Thank you so much. Bye. And I will see you
Bye.
again
Take
some other
care.
time. Bye.
Inshallah. Bye. Thank
Yeah.
you.
Thank you. Yes, Mavish. And you can take it like a last message or take it like a question but from both of you. Uh, like self love is important, self care is important here, like as earlier Fatima mentioned, loving yourself is something that I also feel like that, yeah, discipline yourself is important. You have to keep yourself disciplined. But the question, of course it was a sort of an addition to that. But when we say as a mindset coach, there is something like when we see we grow old, like we would be at the age of 40s, and then there is a lot of hormonal disbalance happening, menopause coming. Anila also did talk about it, PCOS issues, even though it's just not 40. Before that, even a lot more ladies and girls, they are suffering with PCOS issues. And now in all this sort of scenario, condition, situation, again, how to deal with it from your side. When you say, okay, your mindset is important, what sort of a message, as a suggestion or advices, you would like to give to my audience, that if there is a problem, like you, no matter you're suffering with any illness, any sort of disease, mental health issues is going on, burnout is there, a lot more, hustle bustle life is going, as Anila mentioned. What advices would you like to give from my platform to my audience? Please go ahead.
ऑल राइट किरण. किरण, एवरीथिंग जो भी आपके साथ हो रहा है, चाहे आप कोई मेंटल हेल्थ इश्यूज है, फिजिकल हेल्थ इश्यूज है, एनीथिंग, हमारे साथ ज़िंदगी में पहली दफ़ा होती है वो चीज़. राइट? अगर किसी को डायग्नोस हो गया कि वो फर्स्ट टाइम है, अब आपको इससे डील किस तरह से करना है? हमारे माइंड इसके लिए बेसिकली क्या करते हैं, आप मेंटली इसके लिए कैसे प्रिपेयर हो सकते हैं? हमारा माइंड फील करता है, कंफर्ट जोन को ईजी फील करता है, राइट? अब वो कंफर्ट, हम एक लाइफ गुजार रहे हैं, अब जो भी कोई चीज़ फर्स्ट टाइम हो रही है वो माइंड के लिए न्यू है। माइंड के पास उसकी प्रीवियस कोई हिस्ट्री मौजूद नहीं है या फिर कोई नेगेटिव हिस्ट्री मौजूद है, राइट? आपने कोई काम पहले किया था, उसके रिजल्ट्स अच्छे नहीं आए, राइट? आपने किसी डॉक्टर के साथ आपका इलाज चल रहा था, उसके रिजल्ट्स अच्छे नहीं आए, अब आप दोबारा नहीं जाना चाहते डॉक्टर के पास, राइट? या फिर आपके पास वो इलनेस, वो बीमारी फर्स्ट टाइम आई है, तो आपका माइंड आपको सेफ जोन में रखना चाहेगा, क्योंकि अल्लाह ताला ने माइंड को डिज़ाइन ही ऐसे किया है, ठीक है? अब जब उसके पास फर्स्ट टाइम कोई चीज़ हो रही है, माइंड के पास कोई प्रूफ नहीं है, वो आपको सिग्नल भेजना स्टार्ट कर देगा कि ये आपके लिए रिस्क है। हमें डर लगना शुरू हो जाता है। जब भी हम उस ज़ोन से, जो काम हमारे साथ पहली दफ़ा हो रहा हो, चाहे वो बहुत अच्छा काम हो, हम नर्वस फ़ील कर रहे होते हैं। एक्साइटेड से ज़्यादा हम नर्वस हो रहे होते हैं। क्यों? क्योंकि हमारा माइंड जो है उस चीज़ का आदी नहीं है। राइट? और हमारे माइंड को डेफिनेशन हमने ऑलरेडी असाइन की हुई है, जो हमने राइटिंग्स, जो स्टोरीज अपने माइंड को दी हुई हैं, वो हमारा मतलब है कि अगर हम कोई काम फर्स्ट टाइम कर रहे हैं, इट्स मीन इट्स अ रिस्क, राइट? अगर वो बीमारी हमारे पास पहले आई है, सो इट्स अ डेंजर साइन फॉर अस। सो हमें मेंटली अपने आप को सबसे पहले ये रिलैक्स करना है कि ओके, दिस इज हैपनिंग फॉर द फर्स्ट टाइम विद मी। So there are many people in the world who is already suffering from this and they have get out from this breast cancer, right? या जो भी बीमारी है उससे बाहर आ चुके हैं। तो हो सकता है मैं भी उनमें से वन ऑफ देम, आई वुड बी वन ऑफ देम फ्रॉम, राइट? सो मुझे अब जब हमने अपने आप माइंड को रिलैक्स कर दिया यहाँ पे, ओके कि ये कोई बड़ी बात नहीं है, हमारा माइंड अश्योर हो गया, अब वो सेफ्टी जोन में वापस आ गया, राइट? अब हम उसके बाद अपने नेक्स्ट स्टेप पर जा सकते हैं। सो सबसे पहले हमें अपने माइंड को रिलैक्स करना है, और माइंड को रिलैक्स करने के लिए यहाँ मैं बेस्ट टिप शेयर करूँगी कि सेल्फ टॉक स्टार्ट कर दें, पॉजिटिव सेल्फ टॉक। लिटरली जिस तरह अभी मैंने अपने आप से बात की है, हम अपने आप से बात स्टार्ट कर दें कि ओके, ये फर्स्ट टाइम हो रहा है बट इट्स नॉट अ रिस्क, राइट? अगर मैं इसका इलाज करवाऊंगी तो मेरे लिए प्रॉब्लम सॉल्व हो सकती है, right? Everyone, for suppose breast cancer is a one problem, बट वो मेरे लिए शायद प्रॉब्लम हो कि मुझे फाइनेंशियल इश्यूज हों, किसी के लिए प्रॉब्लम हो कि अगर मेरी लाइफ खत्म हो जाती है तो मेरे बच्चों का क्या होगा, इस बात को सोच के वो ज़्यादा परेशान हो रहे हैं, राइट? तो सबके लिए स्ट्रेस की सिचुएशन, प्रॉब्लम एक ही है, ब्रेस्ट कैंसर, स्ट्रेस अलग अलग होगा, स्ट्रेस की वजह से फिर अलग अलग जनरेट्स होंगे, ठीक है? तो मैं उसको कोई एक रेसिपी नहीं दे सकती, हर एक के लिए रेसिपी डिफरेंट होगी, उसकी प्रॉब्लम के सॉल्यूशंस अलग होंगे, राइट? सो लेकिन बट वन ऑफ द मोस्ट इम्पोर्टेंट थिंग, अपने आप से बात स्टार्ट कर दें, सेल्फ टॉक, कि ओके ये प्रॉब्लम आ गई है, बहुत से लोगों को ये प्रॉब्लम आई थी, बट मुझे देखना ये है कि मैं इसमें सर्वाइव कैसे करती हूँ, आगे कैसे बढ़ना है मुझे, राइट?
Thank you
उनका
so
माइंड
much.
रिलैक्स होना शुरू हो जाएगा। दैट्स,
Thank
थैंक
you
यू सो
so
मच।
much. Self talk is important. Okay. I remember, Anila, you said, like, if you are suffering with any disease, any issue, and you are getting worried about your children, that it is something, what will happen if I die, and what will happen to my children, and who going to take care of my children? Isn't it something I also feel like you can, like, this would be last message from your side, and last question to you also, you can add up to Mavish message as well. Isn't it something, the way I feel it, that rather than to prepare your children before, like, your death, make them independent, make them disciplined, tell them everything, try to share your problems, and try to share their problems as well, like a sort of one group or a family. uh, I see that way. What would you like to say about preparedness for your children, or those worry when you feel like to overcome? And last message from your side, please, Anila, mic is yours.
Okay, thank you so much for asking this right question actually, because sometimes we are so scared to even think about those things, like that thing like you're saying right now. And the important aspect of this world is that it's not that I'm talking about spiritual aspect that is temporary, but the thing is that as a human being, we survive situation, and we are giving ourselves very little credit for that. Like we survive the situation. We have been surviving bullying in our classroom. uh, like teacher would punish us in our classroom, and there were so many things happening when we were growing up. And at that time we would say, oh, hum kis musibat mein phas gaye. But later on we will get the idea that your brain is, or your body, or let's say the situation was preparing us for that. When a child is growing up, remember one thing, that to tell that how to love yourself, how you are important, how you are a blessing, because this is what self love is all about. That life is a precious gift. We all know that life is precious gift. It's a gift, let's say. And how we are going to live that, and how we are going to take stand for ourselves, and how we are going to uh, understand that my action have consequences. Because sometime when you're growing up, like when a child is growing up, और वो कुछ कर देता है, तो you don't speak with your child that whatever you are doing, abhi to aap usse wo ho gaya, like you're getting away with this because aap chote ho, but it's going to happen when you grow. You cannot have those things when you're growing up, or aap usse, like you cannot get away with the thing that you do in your later life. Aapko consequence ko face karna padta hai. So being realistic is very important. Like that is a reality. Bimari koi bhi hai, that is a reality. But I have seen people started cursing even themselves. I have this stupid bimari, I have this stupid condition, what's going to happen to me? And somebody's punishing us, God is punishing us, and we have this deed. Because you know that जो गिल्ट है, जो हर चीज अपने सर पे ले लेना, गिल्टी होना किसी भी सिचुएशन के बारे में, और अपने आप को सोचना, कहना कि मैं इस सिचुएशन का रिस्पॉन्सिबल हूँ. We are responsible for our action and the consequences that is coming from our action. We are not responsible for what people have been doing and what their actions are. But we are responsible, let's say, that how we are going to act according to that. Responsible in terms of हमने कितनी डिस्टेंसिंग करनी है, कितनी बाउंड्रीज क्रिएट करनी है. जहां तक आपका सवाल है, देखिए वही वाली बात है, when you're giving the real hope to people, and when you're realistic in your approach, and when you accept the reality. Either it's like, जैसा फॉर एग्जांपल बच्चे ने सच बोला, आपने उसको मार दिया. बच्चे ने कुछ सच बोला, आपने उसको सजा दे दी. सच बोलने पे क्यों सजा देते हैं आप बच्चों को? सच बोलने पे you should be appreciative of that thing. Preparing your children for that is something like when you start setting goals in your life, और जो कि realistic goal होने चाहिए, जो कि attainable भी होते हैं. That's how you understand that this world is a situation for us, and situation can change anytime.
Right.
And as far as you're talking about preparedness of the children, which is very important. जब बच्चे बड़े हों, tell them how important that is for them to be independent in their thoughts, in their actions. सीख, like सीख. And एक और चीज भी, जब हम ये सब कर रहे होते हैं, और जब हमने गलत म्यार बनाए होते हैं, तो लोग उससे माफी भी नहीं मांग रहे होते जब वो कोई गलत काम करते हैं. Like the idea around that, the idea around yourself, when not even true to other people, how you can be true to yourself then? क्या आपने एक टॉक्सिक वो माइंडसेट क्रिएट किया हुआ है, जहाँ तक कॉन्फिडेंस की बात होती है कि और अपने मेरे ख्याल से पहले भी चीज पूछी थी कि व्हाट इज द डिफरेंस बिटवीन इफ समबडी इज कॉन्फिडेंट एंड समबडी इज नॉट कॉन्फिडेंट, एंड सेल्फ अवेयरनेस क्या है, सेल्फ लव क्या है, वो किस लेवल तक जाके आपने, और कॉम्प्लेक्सिटीज होती है कि नहीं होती, आप दूसरे से बात करते कि नहीं करते, ये जो आपका सुपीरियरिटी है वो कहाँ से आ रही है, वो इंफीरियरिटी से आ रही होती है. दिस एक्चुअली हैपनिंग. Somebody who look like that, he can get away with anything, he can get away with him being narcissist. That is his complex are talking at that time. So I just like to wrap up this discussion telling people that accepting will take time. Any condition, जैसे फॉर एग्जाम्पल इवन ब्रेस्ट कैंसर ही है या कुछ भी है, उसमें टाइम लगता है. अपने आप को टाइम दे. डिप्रेस होने में, बुरा फील करने में, लो फील करने में कोई बुराई नहीं है. अपनी फीलिंग को एक्सेप्ट करें. यू आर एक्सेप्टिंग एवरीथिंग, यू आर नॉट एक्सेप्टिंग योर फीलिंग्स.
Definitely.
कि मुझे तकलीफ है, दर्द हो रहा है, फलाने बंदे ने मेरे साथ बुरा किया, मैं बुरा क्यों ना फील करूं, मुझे बुरा फील करना चाहिए. If somebody deceives me, I have to feel bad about that. That he deceived me. If some bad happened, say that bad happened. और होता है लोगों के साथ. तो हम जितनी भी तैयारी कर लें, जब तक हम or self love. This is what self love is. Accept your feeling. And I don't like to talk about feeling negative or positive.
Mhm.
गुस्सा आना एक फितरती अमल है, you know. बुरा फील करना, डर जाना, these are natural things that is going to happen. Feeling bad about somebody, even hating someone, they did something to you. Hate is a natural reaction. It's not about positive or negative, you know. माफ करना आपकी मर्जी के ऊपर है कि आपने माफ करना कि नहीं करना, और दोबारा बात करनी कि नहीं करनी. Even that include forgiving your parents, forgiving your friends, you know. Do that for your own self, you know. Or it can go beyond that, but I'm just trying to tell people that everything will one side, and you accepting your feeling on the other side. Accept your feeling first. Yes, I'm feeling bad. Yeah. I think
Thank
that's
you.
enough for today.
Thank you so much. We'll just keep on continuing because we keep on doing the talk of our heart, of our Maya, and then the session goes on and on. And I would definitely going to be bringing up a lot more sessions with different topics with my beautiful friends and my beautiful colleagues. So thank you so much. You joined also Mavish today. And Anila, as always, you be there with me whenever I ask you. So thank you so much for that, for your instant approval. Yeah, I'm coming. Take me in. Thank you so much for that. So, in last, as today was a session about, like, we had to bring the awareness about breast cancer. So, I think we did our part from ourselves. So, in last, my humble message, my soft message, that's take care of yourself, love yourself, care yourself. And self love doesn't mean that you're being selfish. It is something that you're taking care of yourself. Love yourself, love your family, love your surrounding, love your environment, and always show gratitude. And for this, there is no negative thing could come, because that's the positive side of people when we show gratitude. And for that, I always endorse it. And Fatima also said it, gratitude journal, it's a good practice, and just we have to keep on doing that. So jazakallah so much. Thank you so much for today's session. I am Kiran Zakir signing off from my side, and inshallah see you soon again in another session, another live podcast. Until you guys take care of yourselves. See you guys soon. Bye. Bye.